The South Bronx is a vibrant community filled with promise, but systemic inequities and decades of underinvestment make it one of the hardest hit by COVID-19. At the Bronx Health Collective at Montefiore Health System, supported by Children's Health Fund, Dr. Robin Scott and her team provide life-sustaining care and resources to families, regardless of their ability to pay. Baby Lobo's parents, Daliana and Brandon, visited Dr. Scott soon after he was born.
Having a baby during the pandemic was challenging, scary.
He had been born in a birthing center in Brooklyn, and because that was during the height of the COVID pandemic, they were released home just hours after his birth. I noticed that baby Lobo was yellow, he was jaundiced. When we got the results of the labs, we realized that he had a problem. He had something called hyperbilirubinemia, which can require hospitalizations for babies his age.
Baby Lobo and his family are among many who faced overwhelming challenges during the pandemic.
Out of all of the boroughs in New York, there were more folks in the Bronx who were infected with COVID and hospitalized from COVID and died because of COVID than in any other borough in the city. And as far as what happened here in the clinic, we had to change the way that we provide care entirely. And almost immediately we started doing telehealth, which is something that prior to the pandemic we'd never utilized before.
They soon saw that many families had critical needs that could not be addressed with clinical care alone.
I think the biggest impact is not knowing where they're going to get food from, where they're going to get most of their resources from. That's where the nutrition team and Bronx Health Collective really stepped up and became a resource for the community, providing essential staples like food, household supplies like toilet paper and face masks, and even some baby supplies for families that had infants. Considering everything that's going on in the world right now, they know that they're not alone, and we can work together to make sure that they feel seen and heard and appreciated. So what I love about the field, nutrition, healthcare, is the representation that I can bring to patients when they see someone that looks like them.
I remember going into Montefiore and seeing this tall black woman come, and she looks like one of my aunts. And it felt like I was being taken care of by a family. I think that's so important.
Thanks to Dr. Scott's advocacy, baby Lobo received immediate care for a potentially life-threatening condition.
We got to the hospital. Everything was set up. He's been killing the game ever since. Lobo is wolf in Spanish, and we have like this quote.
You remember it?
The strength in the wolf is his pack. The strength in his pack is the wolf. We will be together, and we will be stronger together because of Lobo, and Lobo will be strong and powerful because of us.
Together, we build stronger children, stronger families, and stronger communities. With your support of Children's Health Fund, we can all be change makers for children.